Hi, everyone, and welcome to the fourth webinar in our 2021 Hear from the Expert series. I hope everyone is keeping well as we make our way slowly into the fall. We are very pleased that today we can offer you this webinar on pediatric transition to adult MS care. We would like to acknowledge Novartis Pharmaceuticals Canada for their sponsorship to make this event possible. Now, my name is Julie Patre, and I wear a few hats when it comes to MS. I'm a postdoctoral fellow at the University of Saskatchewan working on the development of an intervention to improve access to healthcare for persons with MS. I also have lived experience as I was diagnosed with relapsing remitting MS when I was 17. And finally, I am also the co-chair of the Young Adult Committee at the MS Society of Canada, as you'll see displayed on your screen. And I'm very happy to be here with you today and being able to moderate this session. So now that you know a little bit about me, let's go over a few housekeeping notes. So the webinar is being recorded for future viewing on our YouTube channel. No participant names or identifying information is being displayed. If you have a question during the presentation, please type it into the Ask Question box on your screen. So that's Ask a Question box on your screen. We'll have a Q&A session after our speaker presents. We're also live streaming on Facebook. And on that note, hello to everyone who's joining us on our Facebook Live. And your questions, of course, are also welcome. Now, please note that the MS Society does not approve, endorse, or recommend any specific product or therapy, but provides information to assist individuals in making their decisions. So again, before we get started, I really wanted to take the time to thank the teens who have joined us today. I know that this is not an easy time. I've been there, but congratulations for really taking the time to be thinking about how to advocate for yourselves and ensure a hopefully smooth switch to adult MS care. Today, we get the pleasure to hear from a neurologist as well as a young person who has been in your shoes. So let's get to it. I'm really happy to introduce our first speaker today, Dr. Myriam Lévesque-Roy. Dr. Lévesque-Roy obtained her medical degree from McGill University, where she also completed her residency training in adult neurology. She then pursued a clinical fellowship in multiple sclerosis and neuroimmunology at the University of Calgary. In 2020, she joined the McGill University Department of Neurology and Neurosurgery as an assistant professor. She practices at the Montreal Neurological Institute Hospital and participates in the clinical care and management of MS patients. In addition to that, Dr. Lévesque-Roy is a consulting neurologist for young MS patients at the Montreal Children's Hospital of the McGill University Health Center. So please join me in welcoming Dr. Lévesque-Roy.
Thank you very much. I'm very happy to be here, and thank you for the invitation. I think this is a transition to adult care is extremely important and often overlooked. So we really want to give some support to the teens and their family members for that transition. So that's the topic we'll be covering today. I will give the first part of this talk, and then we are lucky to have a perspective of a young adult living with multiple sclerosis, Louis Ficocelli. So some of what we'll cover in this talk, so important questions: why is a formal transition to adult services important? What are some of the challenges that teens can experience during that transition period? What should you ask your pediatric care team in the year before transitioning to adult care, and how can you prepare in advance? And as we said, we'll get to hear from a young person's perspective. And we'll also talk about how can healthcare teams better support their pediatric patients. So this is just a quick overview about MS in Canada. So Canada has one of the world's highest rates of MS, with about 1,100 new cases each year. Over 90,000 Canadians have MS, and the Prairies and Atlantic regions have twice the number of cases as Ontario, Quebec, or BC. Young patients and MS, so it's one of the most common neurological diseases among young Canadians. The disease typically starts between the ages of 15 and 40. Pediatric onset multiple sclerosis is relatively rare compared with adult onset, but up to 10% of those with MS can experience their first symptom before the age of 18. And I'm working at the Montreal Neurological Institute, so I just want to give a quick overview of our clinic. We are affiliated with McGill University. So this is a research and teaching institute. It operates one of the Canada's oldest clinic devoted to MS patient. And each year we treat a large cohort of MS patients with over 2,300 patients. We use a multidisciplinary approach, meaning that we collaborate with the nurse specialists, physiotherapists, occupational therapists, social worker, and to all collaborate in the patient care. Patients may also participate in clinical trials, looking at new MS therapies as part of the Neuro's clinical research unit. So why do we need a formal transition to adult care for young adults with MS? This is important for several reasons. It is well recognized that transition to adult is actually a major issue in adolescent care. Some of the education materials are often geared towards adult and have to be adapted for adolescent care as well. Adult services can be better equipped to deal with some aspects of the care, such as the sexual health and balancing the treatment with the work constraints. But really, the benefits of this transition is to have the time to build the skills in order to really have the control of their own care and to gain more independence when transitioning to the adult healthcare system. And I think this is one of the key points that I want to make, is that we really want to support the patient transitioning to the adult care in making their own decision and choices about their health, while being fully supported in that process. This transition also helps to reduce the uncertainty about how the key medical information will be transferred. And it also helps to clarify the next steps of that transition. So, although most of the transition to adult care, from my experience, go very, very smoothly, it's important to outline some of the barriers that can be present during that process. From the pediatric team perspective, some of the pediatricians may be fearful of letting go of their patients, especially if they feel that some of the adult services are different than those that they were providing. There can be a sense also from the patient themselves to feel like they are the sense of abandonment as they have to leave their familiar medical team. And it takes some time to develop trust in a new doctor, and that is completely normal. And adult physicians may have a different style of consultation than their pediatrician. From the family standpoint, it can also feel a little bit threatening to move to this new adult environment. Adult physicians may have less training actually in pediatric conditions. And so they may be less used to working in multidisciplinary teams. So what are some of the challenges that teens report when there is no formal transition process in place? So a lot of what was reported in the studies was a feeling of sadness. a sense of being lost also in a new environment, not being followed as closely. This also was reinforced by having to tell the diagnosis story on multiple times. And there can also be a sense of distress by being surrounded by more elderly or disabled patients. From the parents' perspective, some of the points that might have hindered the transition process was a lack of coordination within the healthcare system. The fact that the young adult is at a very vulnerable time during that transition, and the lack of some of the appropriate resources in adult care. Some of the things that facilitated that transition process was the parents' resourcefulness, family support, and being able to establish new relationships within the healthcare setting. And I think that is a key aspect here, is that although this transition process can be stressful, a lot of things are in place, and people, as much as we can, we try to facilitate this process and build this new trusting relationship. Now, it's also important to outline some of the tools that can facilitate this transition care process. So here are some things that you can do even before your first appointment with the adult care provider. So basically working with either your previous healthcare providers or your parents to really outline the diagnosis story. So that includes when were the first symptoms, when was the diagnostic made, details about any relapses or flares that you might have had since then. You can write down the name, the dosage of the medications that you're taking, and bring the names also of your previous pediatric care providers. Prepare a list of any questions that you have is also extremely important. And then what usually would happen is that your medical file would have been transferred already to the adult care provider, so that will be available to them. But those are things that are good for you to be even more prepared for your first appointment. Some of the questions that you might have for your pediatric healthcare team, even before that transition, is just starting to ask them, okay, so what is the plan for the transition? How is my medical files is going to be transferred? A lot of the times you can ask them if you can even meet your adult neurology team before you turn 18. And then you can ask even for a coordinator to be introduced to the adult MS clinic. You can ask whether you'll have access to the same services also in the adult clinic. And feel free to ask them also, is there anything else that you can do to best prepare for this transition? Also, about getting involved in research. So when you turn 18, you may be eligible to take part in clinical trials. So this is an opportunity to access new treatments that your neurologists believe may be better suited for you. So again, this is something to discuss first with your healthcare provider. And this is an opportunity to contribute to research and scientific advancement. So I just want to outline some of the resources for young adults that are available. So some of those websites provide some transition checklists and some guides. Sick Kids Toronto has a booklet also, and even a printable passport if you want to keep some key information. CHIO also has some introductory video. And feel free to, again, ask your pediatric healthcare team, because they may know if there are some additional resources also available for your center. Now, talking about how can healthcare teams better support you. So here is an example of a transition timeline. So this is just, an example of what can be done in order to start planning well ahead of time for that transition. So even before the age of 16, you can already start discussing with your pediatric healthcare provider. Maybe start working on some transition checklists. Then around 17, you can maybe plan a meeting with the adult care clinic, reviewing the process of the transition, meeting their new neurologist for the first time, and then so by the time that the patient has turned 18, they have already had some time to process that transition, and may have already met the adult care team. Now, this is very different, again, from center to center, depending on how things are set up. But again, just discussing in advance with your healthcare provider and see if there are some things that can be done even before the transition. So those are, again, other examples of resources when talking about transition program. And so now every center, again, is different, but things that can be used are, for example, a checklist, having someone helping you coordinate this transition. We'll talk about some of the support groups also, and some of the resources that can be helpful for young patients. Having a care passport, so having some documentation with you. Some of the resources that are available also in the clinic, again, with this multidisciplinary team. And then some of the outreach program also. I think it's important, as I mentioned at the very beginning, I think transition is often overlooked. So I think part of that talk is also in order to sensitize patients and the community to the needs for patients to have a smooth transition. Some of those resources are available also for healthcare team. So those are websites that basically show national guidelines to help implement some of the transition practices. So those are excellent resources as well. And to that, I'll conclude my talk by thanking everyone for joining us today. And those are our contact information if you have any questions specifically about the MS team at the Neuro. So don't hesitate to reach us if you have any question. And on that note, I will leave the microphone for the rest of the talk.
Thank you so much, Dr. Levecroix. It was really interesting. And I myself didn't end up going through that. I was 17 when I was diagnosed, but I just got put directly into the adult care. So I can only imagine how complicated the transition can be for someone, especially if they're newly diagnosed. So thank you for that information. I did want to mention that if you do have any questions for Dr. Levecroix, that you can still ask them now, and she'll be back just after we have our next speaker. So on that note, I'm really excited that today we not only get the perspective from a neurologist, but we also get the perspective of someone who has made this transition and can share their experiences and tips. So we have here with us Louis Ficocelli, who currently works at the office of the academic dean at Vanier College. He had his first episode, characteristic of multiple sclerosis, at the age of 15. and was diagnosed at 16. Louis is now 24 years old and is confidently living with his diagnosis. So, on that positive note, I will throw the mic to you to talk a little bit.
Hi, so my name is Louis Figocelli. I'd like to start by saying that it is a pleasure to be here. And I want to make it clear that my answers to the following questions is strictly my perspective. And I want to highlight that the points presented by Dr. Levesque-Roy are highly informative and important in this field. So thank you.
Okay. Thank you. So, on that note, I get to ask all of these questions now. So, I'll start with from your experience, what are the key challenges facing teens entering the environment of an adult outpatient care system?
So for me, the key challenge was the novelty. As you said, I received my diagnosis at 16. So personally, I was just getting to know the medical team at the Montreal Children's when it was time to change to adult care at 18. So my experience in child care, almost felt like a stepping stone, like I was nowhere permanent yet. And in that short time at the Children's, my doctor also changed. So I felt a lack of consistency there. And it don't really feel like I had time to connect with my medical team. Um, Others might have a longer experience in adolescent care, but it does not change the feeling of having to start over when you do transition. With the neuro, I have experienced more consistency simply due to time, and that for me is an important factor. That consistency helps to create an environment where my doctor and medical staff can see me as a person rather than just a number. And in fact, my doctor presented my name as a possibility for this talk today, and I accepted so that I can let others know that you and that we are not alone. We all have our challenges that may present differently, but it is manageable. So when I transitioned from teen care to adult care, there was a transition program in place that certain members of the Montreal Children's Hospital were involved in. These members were individuals involved in patient care and served as a familiar face in the transition period. One individual introduced me to what would be my new team at the neurological. Now, I only experienced the children's for roughly 2 years, and I consisted of a few appointments. However, I appreciated the familiar face. And I can imagine how someone who was being followed from the age of 14 or 12, 10 years and under might feel about that. So programs like these are simple, but I believe should be encouraged to aid in a more comfortable transition to adult care.
And so from our talk, we did see that Dr. Levesque-Roy mentioned that, you should be preparing some questions and thinking about things to help out in this transition. So can you share a few questions parents and teens should ask of their pediatric care teams in the year prior to transitioning?
Sure. So first off, I would probably ask about the differences between teen care versus adult in terms of treatment or appointment schedule. COVID changed the usual setup of appointments, so I think we all wish for a return to normalcy soon on that front. But if you are used to a certain scheduling, ask if that is still possible or if that is still necessary. It is always great to discuss options with health professionals for follow-ups or treatment. This could be something to keep in mind when actually meeting your adult neurologist. This way, you or whoever you may be listening in for does not feel like they have no say going forward. And a crucial factor for all of it is feeling control of your health when dealing with illness of any kind. So another important question to ask, I would say, is what can I do outside of receiving treatment for MS? So this is important because certain medications that you may choose can have gaps in time between treatments. For example, I have taken medications that were 3 times a week, once per month, and now every 6 months. So it will become important to look after your health on your own. And doctors may suggest to avoid certain foods, for example, or to increase your exercise. But altogether, we'll advise not to overexert to the point of exhaustion. Personally, I do a few quick, simple exercises daily to keep active, and I have been doing that for about 4 or so years. And what I have discovered is that managing this is about what you feel comfortable with and knowing your own limits to your illness, and you'll develop and you'll learn more about yourself as time goes on.
Yeah, no, I've definitely come into some walls with trying to manage my energy and overdoing it. It took me a few years to get to a point where I could figure out where my limits were. Not gonna lie.
Right.
Um, so, what is or are the most important things to do or prepare once you are assigned an adult neurologist?
Like Dr. Levecroix said in her PowerPoint slides, and I would say is the most important thing, is prepare any questions that you may have that may be causing you any lingering fear or doubt, or any question you might have about the illness itself. We can consistently learn about what we are going through. As I've seen throughout the year so far, and as we've said already, there are many things to learn about MS. The journey is an ever evolving one where we begin to know and continually learn about the illness and our own personal limits. So I think it is important to do your own research regarding your diagnosis and discussing what you have learned with your healthcare professional, and they may be able to guide you in your personal research to manage your illness. Another important point is to ask your professional what they believe is the best course of action in terms of treatment. It is important to be comfortable with the paths chosen in order to better understand their suggestions moving forward. That being said, personally, the current treatment options are only getting better in terms of efficacy and reducing relapse frequency. So I am all for it. And as I said, I've tried different medications, and yeah.
So I think some of the things you keep saying is just having this idea of being in control of your own health care and making sure that you're informed and getting the appropriate information to make decisions for yourself.
Absolutely, because if there's some uncertainty or the fear, that's where the fear lies. I believe that the knowledge is power in this circumstance and going forward. And if you can learn every day, then do it every day.
Yeah, that is a great statement to live by. Okay, so from the patient perspective, how can healthcare teams, both pediatric and adult, better support their pediatric patients?
So for me, it is crucial to assure newly diagnosed individuals that they are not alone. Prior to receiving information about MS, the image I had in mind brought about negative feelings. And as a 16-year-old, I had very basic ideas of what an individual with multiple sclerosis looked like. The unknowns about my diagnosis led to increased doubt, like I had said, fear and uncertainty of what lay ahead. And I believe physically providing information is great. I could tell you firsthand that the information I received and sought out was key to understanding my illness and handling my fears. One tool I believe should be more present in all the pamphlets and all information I received would be to include a more social component. When I was first diagnosed, I was offered counseling services to help with the diagnosis. Having recently graduated university with a bachelor's degree in psychology, I can understand how speaking to someone in a professional setting can be very helpful. But sometimes having a simple conversation with an individual that shares my experience can make the biggest difference. For instance, sometimes I wonder after having a relapse, what does somebody else's story sound like? Or I wonder what others with MS are going through. That ability to find out that firsthand experience is what I believe lacks in the major approaches to MS. But as seen in the previous PowerPoint, these programs can make a huge difference for individuals experiencing MS. And I can see how the approach has evolved from when I was diagnosed 8 years ago. So perhaps supporting pediatric patients lies in allowing them to meet and communicate with one another. In the internet era, where laptops, tablets, smartphones, and social media are becoming ever more present, it is certainly possible, and it was certainly possible to have this seminar today. So maybe a group chat, a social media page, or even having someone else's number that has been experiencing MS allow you to have access to their thoughts, their ideas, their queries, and questions that they might hold. This form of network allows for others to live through the experience with a sense of togetherness rather than loneliness. And I truly believe that that is powerful. That being said, the MS Can Be event is taking place virtually October 1st and 2nd, 2021. And that is a great example of this idea that I have been explaining come to light. Events like this can connect the MS community and is something I wish was around more, or I knew about more when I was first diagnosed, to help calm my insecurity regarding the future. I believe it is helpful to talk or hear from individuals with the illness to validate, your limitations and to generate clear expectations. I now know that it is okay to listen to your body, your mind, and say, I need these few hours or this day to rest or recuperate. Hearing this message from someone sharing my experience, your experience, will help normalize what you feel. For example, if I feel too tired to go out with friends, or others have those tired days too, and that is completely fine. So I'd like to conclude by saying there was a common thought that ran through my responses today, feeling that sense of control, as you highlighted, Dr. Julie, over your health, and having a sense of belonging are both important for your journey, whether it be through the active search for knowledge and information online, or the relationship formed with medical staff, or even hearing voices of individuals that share your experience. This can help guide your continued quest to discover what a life with MS or any other illness means. It can create an environment where you feel like everything can and will move forward, and everything has been, and everything will go on.
Thank you, oh my God, my brain. That is brain fog right there. Um, Thank you so much. That was so well said. And I think it will really help a lot of people to think about their situations and normalize their situations as well. And it'll help people try and figure out their next steps in transition. So I really wanted to thank you for your candid thoughts and those excellent tips. And now we're ahead of schedule, so we have a bit more time for audience questions. And so we'll have both of our speakers join us on screen, and I will now get to those questions. Okay, so we have one here for Dr. Levesque-Croix. What can I do to look after my health? Are there any strategies you offer to younger patients? I'm afraid that health decisions I take now as a teen will affect me in the future, such as treatment options. What should be considered? Loaded question.
Excellent. Yeah, excellent question. A lot of very important points. And even before addressing that, I really want to thank Louis for sharing his perspective. Extremely thoughtful perspective, and I think this is such a good role model for any teens or adolescents, young adults with a diagnosis of MS. So thank you so much, Louis. So that is an excellent question. So what are some of the other important things that patients can do for their health after they are diagnosed with multiple sclerosis? So there are several aspects. I think, one things that we always tell patients is, first and foremost, as Louis mentioned, is to make sure you're asking all your questions that you have to your healthcare provider. We reinforce with patients the importance of lifestyle. So Louis alluded to that. So having a healthy diet, being physically active. We always encourage also smoking cessation, but it's just having an overall healthy lifestyle is extremely important. also similar to what Lewis alluded, is to discuss with your healthcare team about the treatment options in order to really make the best decision for yourself. And that is extremely important. And I think this is what I would say kind of overall to patients, young patients with MS.
Okay, so like focusing a lot more on those lifestyle choices that can be used as modification.
Exactly.
Okay. Thank you. Okay, so we have another one for Dr. Levesque. So someone says that my hospital doesn't seem to offer those additional supports, the multidisciplinary supports that you mentioned, like a social worker.
Mm-hmm.
So how do
Mm-hmm.
I get to one, and where can I find these resources?
Mm-hmm. Yeah, I think that's a good point, because all the different clinics are built a little bit differently. So one of the things that you can do is basically just asking your health care provider if that is not available directly through the clinic. Could it be available through some other care centers? And you gave the example of social worker, but that could also be for a psychologist, seeing a physiotherapist. So again, it's just kind of asking and seeing if the resources are available outside of the clinic, and that will be the case in the vast majority.
Okay. Thank you. I did also want to note that I have had some success using the MS navigators through the MS Society of Canada.
Mm-hmm.
They can offer some additional support in actually finding individuals, and that info will be posted at the end for anyone who's interested. So now I'll get back to the next question. This is for both speakers. So, are there any tips for my child who was recently diagnosed and now starting a new school year? How should I prepare them to explain the disease to others?
Extremely important question. And I'm looking forward to have Louis' perspective also on that. I think explaining the diagnosis to others can be very stressful, um, especially, other people might not know what MS is, and I think it's important to know, of course, that you don't have to divulge the diagnosis to people that you don't feel comfortable sharing with them. But it's also important to find some people that are you're comfortable with sharing, and who are trustworthy, and in explaining it in kind of simple terms, and also referring them to some other resources like the MS Society of Canada, if they have some additional questions on that. But I think sharing this with the peers is something that does come up, and yeah, I think it's important to discuss. I'm curious to see what Lewis has to say.
Yeah, so when I experienced my first episode, I was actually in secondary four. So, yeah, secondary four. So I had to explain exactly that to my friends of like what's going on. And at the time, I wasn't diagnosed either. So the tips I was getting to explain, or yeah, to explain it, I was simply saying there's something, going on with my central nervous system, and I kind of left it at that. I might have delays, I might have some problems there. But as a child, if it's something younger, I would stick to something simpler, like maybe, sometimes I can't play as hard, or sometimes I need to relax more, or things like that, I think would be a comforting way. And like Dr. Levesque alluded to, definitely find your circle of people that you confide in, that you find comfort in, to build your relationship. And maybe as you go on, you can go on telling people that you're not so comfortable with, but because you have that group, because you have your confidence already built up, you can branch out and work on becoming more open with it. So yeah, and as of now, like 8 years in, I have no problems talking about any form of my relapses or any details. So I think that process worked for me, starting inward and branching outward.
That's a great point. Um, okay, let me see here. Okay, this one's for Lewis. As a young person, were you concerned that the disease would impact your goals? So, your goals to travel or play sports and work in the future? And how did you deal with that emotionally or even practically?
Right. So initially, I had that exact response. I played basketball for high school, and I played competitive soccer for like the inner city. So that was definitely a question for me. And when I initially had my relapses, that did impact my performance in those sports short term. But I knew with the right treatment or things like that, it would be temporary, and it did move on. And I think with time, my confidence slowly grew back, and to the point where I've rejoined playing those sports. If something blocks you from doing it, you don't shut it out forever. That's my advice.
So, then is it to kind of adapt?
Right. Yeah. So it definitely holds a way to adapt because there's this new diagnosis hanging over. It seems to always be hanging over your head, and you, no matter how much you try to ignore it, it's still there. It'll still be present. So accepting and adapting. You adapt by accepting, I would say, so that it can go forward. Definitely.
Well said. Okay. For Dr. Levecroix, what can I do if I feel like the care I'm getting is not good? Or if my doctor isn't listening to me and my concerns? Or if I simply want to change doctors?
Excellent question. And I think first and foremost, it's important to speak up if you have those concerns. Because this can be hard as well, but really make sure that you're bringing up those concerns with your healthcare team, and it's always because it's so important. The trust, I find, is one of the most important part of the care in multiple sclerosis. And so it's important to find a healthcare provider that you trust and that you are comfortable with. So I think it's important to discuss it directly with the healthcare provider and seeing maybe how things can be adjusted for you to feel more comfortable. And if that is not possible, then there is always an option for a patient to change physician, and that is basically something that you can ask and request to change to another neurologist. But yeah, it's so important to have someone you trust in that whole process.
Of course. Um, okay. There, this one is for Dr. Levecroix. So there are a lot of complicated words to describe treatments. Where can I learn about these in an easy to understand way?
Excellent questions. And I think this also brings up the point also that Lewis was making, that it's information is power. So the more you know about the different treatments and the different options, the better it will be, the easier for you it will be to make that decision. One of the resources that I often give to the patient is again, the National MS Society of Canada. They have an excellent section on all the disease-modifying therapies, and those are well explained. Your healthcare provider might also have some other resources, but it is very important when you're discussing therapies with your healthcare provider to make sure you understand very well the different options, and asking all your questions. The clinics who have also MS nurses, they are also a very good support, because often what happens is you're getting all this information about the MS therapies, and then you're reading about those, and other questions might come up. So it's very important to ask those questions, and most people have specialized nurses that can help with that, or booking another close appointment with your neurologist also. But in terms of online resources, personally, I refer to the MS Society of Canada. Oh, you're
Julie, I
muted.
think you're muted.
Yeah, sorry, the dog was barking. Okay. So for both of you now, as a parent, any other tips on how to best advocate for my teen? How can we ensure we get heard when there are so many patients?
Excellent question. I think, transitioning to the adult care, as we mentioned, we follow a lot of adult MS patients. So people might feel that they're just like, one in 1,000, and I think it's part of that transition process. But it's very important to know that even though it might feel this way, is you should always advocate for your needs. Always ask your questions if you have some. Make sure you have the contact information for the clinic where you're being followed, and knowing that you can have access to the nurses or other resources whenever you need to. So I think that's also a big part of that transition, is knowing, okay, what are the resources available, who I can reach if I have questions or things that I want to bring up, and I think that's extremely important. Yeah, I'm curious to
Louis?
see also what Louis.
I think there's not much to add on that front, really, regarding that question, like you said.
Thank you. I will have, there's no more audience questions, but I have one quick question for whoever may answer. So I was curious. At least I know whenever I was, initially diagnosed, and I still come into this, I get these symptoms all the time. There's weird stuff that crops up all the time, and whether it's MS or not, you're trying to figure it out. How do you kind of make the decision of like when you should go and seek care and where you should seek care? Like, if you think
Mm-hmm.
you have an MS related issue, should you seek care from your neurologist, knowing
Mm-hmm.
that they're very busy and it's difficult to get an appointment? Or like, when do you know when to try and get care elsewhere?
Excellent question. And I think that's something I try to cover even from the first time I'm meeting a patient and where we are introducing the functioning of our clinic. And I like to provide the patient with education about, so what's considered a relapse. What are the symptoms that you should be looking for? But what I always tell to patients is, if you're not sure, just call us, give us a call. Every clinic is different. The way we work is we have nurses available. So phone lines where patients can call if they have new symptoms, and they can discuss that with the nurses, who will then discuss with the treating neurologist. But again, every clinic is different. So that's also one thing to discuss even from the first visit, is what should I do if I have symptoms? And of course, knowing when to present to an emergency room setting. So with severe symptoms that need urgent care. So that's an excellent point as well. Louis, I don't know if you.
Yeah, I'd like to add on. So, in terms of personal experience with emergency room relapses versus minor things, for one instance, I felt like I should seek medical attention immediately. So I had gone to the emergency room. But by the time I had my next relapse, I realized that contacting my doctor and him getting back to me in a short amount of time, of course, he is a better option than waiting. I don't know, 8 hours, because in an emergency room, when I presented with my relapse, it wasn't seen as life threatening, as it shouldn't, because it was something minor, as you went over. So I discovered with that was part of my learning process, is to go and typically I receive steroid treatments intravenously to get over a relapse. And I'm sure you can go into more detail about that. I don't want to take your explanation away from that if you would like. But for me, that is what works for my relapses. There are certain minor things that I have not gotten those treatments for, and the body becomes highly dependent on that type of thing if you continually use it. So I'm sure if Dr. Levicroix wants to expand on that, the body should not get used to that amount of steroids to help us get over that.
Mm-hmm. Yeah. I think Louis, what you're mentioning is certainly what we would do is we so if for minor symptoms, we would evaluate with the patient and determine whether or not they would benefit from a steroid treatment. Determine if we feel that it's a relapse or maybe more a fluctuation of their symptoms, and so that's all going to be part of our discussion. And then, of course, we tell patients that if they're having very severe symptoms or atypical symptoms, like symptoms that are sudden in onset, being unable to walk, of course, those are all indications to present to an emergency room. But we make sure that patients have good access to the nurse's phone line if they have those questions.
Right. I'd just like to add on for the first relapse that I had in high school was one that it was sudden, and I did present in emergency room like that. So if it's not as severe, because the typical one is to stop walking, but mine was associated with trouble speaking. So for periods of 10 to 15 seconds at a time, I would just have trouble voicing what was coming out. It was like the process is slowed down, and then I was back in all of a sudden. So when that started to repeat and got more common, that is an example of when I presented to the emergency room for the first time as my severe symptom.
Exactly.
Well, thank you guys both for both of those responses. I think it will actually really help some people as they're trying to navigate the new reality if people are recently diagnosed. I think, knowing that you can call into the MS clinic and speak to the nurses and potentially then get information back from your neurologist is really valuable to know. I know that I did not know that when I was initially going through it. So I do think that it is very valuable for people to hear that. So again, thank you so much. That is unfortunately all the time we have for questions today, but thank you so much for your interest in the topic. And of course, thank both of our amazing speakers today, Dr. Levecroix and Louis Ficocelli. We are so lucky to have been able to take the time to share your expertise and your experience with us. And I really, really enjoyed just listening to it, and I learned a lot as well. So just thank you so much again.
Thank you very much. I really appreciate.
Okay. So before we wrap up, I would like to highlight some upcoming events of specific interest, and Louis has actually alluded to. For those who are between the ages of 18 and 40, there is MS Can Be that's coming up. Now, this is our 2-day nationwide summit for young adults affected by MS. You get to come and meet virtually at this point, but meet others, learn, and get inspired. So visit our website for more information and to register. If you're also interested in more webinars, our partners at Can Do MS in the US offer monthly webinars, and on October 6th, you can join them to learn about staying physically and emotionally well during the winter, which we know from the talk today that is very important. And I also wanted to remind you, and I already alluded to this as well, that the MS Society of Canada has a knowledge network. And this knowledge network is staffed by trained navigators to answer your questions related to MS. You can see on the slide here how to connect with them through phone, email, and live chat. A final reminder that you will be receiving a survey following this webinar, and I really encourage you to fill it out to let us know if the information you heard today was valuable to you. Again, of course, I'd like to thank Novartis Pharmaceuticals Canada for their sponsorship to allow this webinar to happen. And thank you again to our speakers and to all of you for participating in today's webinar. Take care and have a great day.